Welcome back. We're talking about the rise of smoking in the developing world. Now our focus shifts to the continent of Africa, where smoking rates in many countries continues to rise. Of 26 countries worldwide where rates are going up, 16 are in sub-Saharan Africa. Joining me now to discuss this trend is Matthew Myers, President for the Campaign for Tobacco-Free Kids, and Yussuf Saloojee is Executive Director of South Africa's National Council Against Smoking. Thanks to both of you for joining us. Matthew, we have seen a sharp drop in the number of people smoking in the developed world, in Western countries. So to a large extent, the campaign against smoking has worked. Now tobacco companies are shifting their attention to other parts of the world. What are they doing to ensure that they still have customers?
Well, you're exactly right. Over the last 2 years, for the first time in decades, we've actually seen total global sales go down. So what they've done is turn like a laser beam to developing countries where you have a rising poor people into the middle class who for the first time are able to afford tobacco products. And what we're seeing there is an exact repeat of what we saw in the developed world 50 years ago. Heavy marketing, largely appealing to lifestyle, young people in particular. But we've also seen a second thing that we saw across developed nations, and that is tobacco industry interference with the government process. We've not only seen heavy lobbying of the kind we saw previously in the West, we have seen very much behind-the-scenes lobbying designed to prevent those countries from adopting the same tobacco control policies that are now protecting our children.
Yussuf, about 80% of the 1 billion smokers in the world live in low and middle income countries. And nowhere, of course, is that more true than on the African continent. And those numbers are going up, as I mentioned. How are tobacco companies targeting Africa?
Well, in a number of ways. Clearly, the most important way of targeting people is through advertising and promotion. And we've seen heavy advertising of tobacco products in Africa. We've seen practices that you wouldn't see in most developed countries. So the tobacco industry will give away free cigarettes. In South Africa, giving away free cigarettes to young people, well, giving away free cigarettes is illegal. But yet I hear stories repeatedly from people saying that the tobacco industry is giving away free cigarettes. It's using viral marketing to tempt young people to start smoking. And of course, another important way is to keep the price of cigarettes down through supporting smuggling. Smuggling is a major problem in many African countries.
Matthew, giving away free cigarettes, how vulnerable are children?
Well, what we're seeing is it's precisely what they're doing is targeting young people who can't yet afford to buy cigarettes on their own. And they're combining those free giveaways with the kind of image marketing that we saw in the West that has frankly been outlawed in all Western countries, making it look like smoking is glamorous, that it's part of being a young adolescent's strength and independence, masculinity, and sexuality. It's the exact same sets of themes combined with making cigarettes easily available by free giveaways, selling them one by one at a critical time, and then interceding with the government to stop the government from taking steps to prevent this epidemic before it reaches crisis levels.
Yussuf, you are in South Africa. You're taking the fight there to the tobacco companies, and you want South Africa to become a model for the rest of the African continent. But what are the major challenges that you're facing right now?
Well, clearly, it is the tobacco industry. South Africa is a model for the rest of Africa. While tobacco use in the rest of Africa is increasing, in the last 20 years, we've seen a dramatic decline in tobacco consumption in South Africa. So the prevalence of tobacco use in South Africa has halved. And this is because the government has had the guts to enact the legislation that the WHO has recommended. So South Africa banned tobacco advertising back in 1999. It made public places smoke-free. It increased the price of cigarettes. It put health warnings on tobacco products. And all of those measures worked. But the tobacco industry doesn't sit back and just take that. So one of the things the tobacco industry has done is challenge the constitutionality of our advertising ban. And it took the government to the courts. and said that the ban on advertising was unconstitutional. Fortunately, with support from the Campaign for Tobacco-Free Kids, the National Council Against Smoking joined the case, and the courts have ruled that the ban on advertising was constitutional. And more than that, the court said that the government of South Africa had a responsibility under the Framework Convention on Tobacco Control to protect the public from the harms of tobacco. And the lesson for the rest of Africa is that tobacco control measures do work, and that when the tobacco industry aggressively intimidates governments by standing up to the industry, you can win.
Matthew, what do you make of tactics like that? And have those tactics been used, say, in developed countries, countries like the United States?
They have been used in the developed countries, but they're no longer successful in the developed countries. Virtually every developed country has either banned or restricted tobacco advertising. They no longer allow free sampling, for example. Right. They have strict rules on sales to minors with enforcement. They have strong warning labels. What we have seen throughout the entire sub-Saharan African region is that tobacco companies have not only engaged in those activities, but they have spent far more money than the population would normally justify. And why? Africa has the lowest smoking rates because of its long-term poverty of anywhere on the globe. This is truly a fight for the long-term health of Africa. If the tobacco companies succeed, the rise in cancer, heart disease, and diabetes throughout Africa will literally crush its economic growth.
So the good news, as far as many African countries are concerned, is that they've been experiencing phenomenal rates of growth. Exactly. But with that comes more disposable income.
With that comes more disposable income, and the tobacco companies have been out in front. Now, a number of African countries are trying to tackle this in addition to South Africa. Uganda recently passed a very strong tobacco control law over the strenuous opposition of the tobacco industry. They even went to the president to try to get him to veto it. Kenya did the same thing. So we're beginning to see progress, but it is literally country by country, battle by battle. And who wins this battle is going to have an enormous amount to say as to the long-term life expectancy of Africans as they emerge from their long-term poverty.
Right, and Yussuf, do you see the same experience in South Africa, where you have this small but growing middle class, which has more money now, which has more disposable income? Are they being targeted by tobacco companies?
Absolutely. The tobacco industry calls them black diamonds, the rising middle class, and it sees the rising middle class as their future target markets. Can I just pick up on the point that Matt has made? The good news for Africa is that deaths from HIV/AIDS and deaths from malaria are decreasing, and they'll virtually halve in the next 15 years. But the bad news is deaths from cancer, heart disease, and lung diseases are increasing and are going to continue to increase in the next 15 years. And this highlights the importance of African countries acting now to prevent the future tobacco epidemic.
And what kind of support, Yussuf, do you get from state public health authorities? I mean, are there the resources there to fight this? And is the fight against smoking getting the kind of priority that you'd like?
Unfortunately not. I mean, the good news, again, for Africa as a whole is that 42 of the 47 African countries have ratified the Framework Convention on Tobacco Control, which this means that they're committed to taking actions which will reduce tobacco consumption in their countries. But unfortunately, when pitted against the resources of the tobacco industry, tobacco control and government efforts to reduce tobacco use are grossly underfunded and lack resources. And I think this is a major handicap preventing more governments in Africa to act. And in fact, it's the opposite. The tobacco industry promises many African countries that tobacco is the route to economic growth, when it's exactly the opposite. We know from South Africa that tobacco use increases poverty, it results in environmental harm, social harm, and also increases cost, lost productivity, and healthcare costs.
Matthew, let's look at one of the success stories in the developing world, Panama. This is in Central America. Panama passed very strict laws against smoking. Smoking is banned in nearly all public spaces. It's banned advertising, promotion, or sponsorship of tobacco products. and it requires, of course, a very large health warning on cigarette packs. In the 15 years from 2000 to 2015, rates dropped 57%. Is that a model that can be used elsewhere in the world?
It is a model, and the good news is that there are a number of models. Panama, Uruguay, Brazil have all taken similar actions, and they've all seen not only dramatic drops in tobacco use, but we've already seen changes in cardiovascular disease, and we can expect to see significant changes in cancer rates as well. Not only are they making their citizens healthier, but they're doing so in a way that will save enormous sums for their government. I think there's an incredibly important story to be told. Africa has the benefit that we now know how to reduce tobacco use. Increase the price through cigarette taxes, strong warning labels, comprehensive mass media campaigns, restrict sales of individuals' cigarettes, does make a difference. It's worked in every country it's been tried.
Right. And Yussuf, we do know that some of those strategies have been adopted in South Africa, but if we look at things that have been adopted in the developed world to bring down the rates of smoking, things like increasing taxes on tobacco, and taxes have been increased significantly in many, many countries. Is that a strategy which would work in other parts of Africa?
Absolutely. In fact, South Africa is very interesting. Since 1994, when the new government came in, taxes have increased dramatically in South Africa, and cigarette consumption has halved. The prevalence of smoking has gone down by about 50%. But more interestingly, when you look at the data, it's not the middle classes and the rich people who've stopped smoking, but it's poorer people who can't afford cigarettes. So the effect of taxation is mainly on the poor and the young. In our context, in Africa, if taxes are increased, this will have a dramatic impact on reducing smoking by people who are poor and the young.